Hi class, this is Dr. Shahada, and in this video I'll be going over Chapter 10 on health reform in the U.S. So in this chapter, we'll be briefly going over the history of health reform and then going into the Affordable Care Act. Now it focuses on the previous attempts at national health reform, why health reform has been difficult to achieve, and then the passage and provisions of the Affordable Care Act. So there's been numerous attempts for health reform attempts in the U.S., and they all failed on the national level before the passage of the Affordable Care Act in 2010. However, there have been some successes at the state level. So on the next slide, it's just listing some of the issues or challenges that have made health reform here in the U.S. so difficult. So here, as I said, is a list of some of the issues that have made it so difficult to have a health reform passed. But even though there is this general agreement that there are a number of problems facing the U.S. in the healthcare system, and these include high costs, high uninsured rates, health disparities, quality concerns. However, politicians and voters have disagreed on the best solution to address these issues, right? So some of the contributing factors that have made health reform so difficult include an individualistic culture, the dislike of a big government and government involvement in the area of healthcare, of course, a lack of consensus, and in many cases here in the U.S., states generally are the home to social welfare issues, and federal system rules and structure make it difficult to achieve major reform. And of course, powerful interest groups, once they're against the national health reform, they definitely have that influence in not getting such a bill passed. Now, in the next slide, or this slide, I'm just briefly going to be going over some of the key failed attempts at national health reform. So in 1912, former President Theodore Roosevelt supported social insurance platform that included health insurance. This social insurance platform was actually modeled on the European social insurance tradition that included health insurance, workers' compensation, old age pensions, and unemployment insurance. After his loss to Woodrow Wilson, the national health insurance movement was without a strong national leader for 3 decades. Then we have, in 1915, the American Association for Labor Legislation proposal for working class health insurance. Now the AALL, or the American Association for Labor Legislation, continued to support a form of health insurance after Roosevelt's defeat and drafted a model bill in 1915. Now this bill followed the European model again, limiting participation to working class employees and their dependents. Benefits included medical aid, sick pay, maternity benefits, and death benefit, and a death benefit. So these costs were to be financed by employers, employees, and the state. Now the AALL believed that the health insurance for the working population would reduce poverty and increase society's productivity and well-being through the idea of having healthier workers and citizens. Now, in the next slide, we're going to jump to President Harry Truman in 1945 calls on Congress to create a national insurance program for those who pay voluntary fees. The American Medical Association denounces the idea of socialized medicine, so of course it goes nowhere. Then the next health reform proposal was by President Nixon, and it was actually initially proposed in 1969, and then it was revised, and a revised proposal was brought forth in 1972. So the Nixon administration's first attempt to health reform focused on changing the healthcare system's financing from one dominated by a fee-for-service system, which created incentives to provide more and more expensive services, to one that promoted restraint, efficiency, and the health of the patient. So the result was a health maintenance strategy intended to stimulate the private industry to create health maintenance organizations, or HMOs, through federal planning grants and loan guarantees, with the goal of enrolling 90% of the population in an HMO by the end of the 1970s. Now, ironically, group health plans, which were often labeled as socialized medicine, had become the centerpiece of a Republican reform strategy. Now, the second proposal, which was proposed in 1972 by Nixon, covered everyone and offered a more comprehensive coverage than that first one. So private insurance companies would cover the employed, and a government-run program would cover the rest of the population, with both groups receiving the same benefit package. Now, Senator Kennedy and Representative Wilbur Mills supported a similar plan, and it appeared a compromise was very close. But this revised proposal did not have a majority support, and again, a national health insurance plan was not enacted. And then we have another proposal that is proposed by President Clinton, and it was a 1,300-page plan for universal coverage, and it required businesses to cover their workers and mandates that everyone have health insurance. The plan, again, there wasn't majority support for it, and it died in the Senate. Now, a major healthcare reform that did make it through, which was actually proposed by President Lyndon Johnson, was the creation of Medicare for the elderly and Medicaid for the poor. Now, next, we are going to talk about the Affordable Care Act. So the first question that comes to mind is, why was the Affordable Care Act passed when there were so many prior attempts to trying to get a health care reform enacted and in place, but all prior attempts had actually failed? And the three that are listed in this chapter and that are covered are the topics of commitment and leadership, learned lessons from past failures, and political pragmatism. So make sure to read each one in detail in the chapter. And next, we're going to go into a little more detail regarding the Affordable Care Act. All right, so in 2010, President Obama and Congress signed in Obamacare. Why? Well, again, usually the idea that healthcare reform is, these proposals of healthcare reform are even brought to the Senate is the idea of increasing access to care and increasing the coverage of health insurance, getting those uninsured rates down in the country. Going to the doctor or the hospital has become very expensive, which we're all aware of. Just one visit to the emergency room on average will hit over $1,200. A broken foot costs around $16,000. And then we look at cancer treatment, and it could cost about $30,000. So people with health insurance don't have to worry about these costs since their insurance pays most of them. The insured only pay a small fee per visit, again, a co-payment, and most people get health insurance as a benefit from their employer. The company usually pays part of the monthly cost, known as a premium. So starting in 2014, you have Title I, which requires 32 to 50 million uninsured Americans to buy insurance or pay a tax up to 1% of their income. So that was implemented back in 2014. Now, those currently who have insurance can keep their plans, but the requirement doesn't apply to illegal immigrants since they don't have access to Obamacare. Now, the controversy regarding this individual mandate is too much of government interference in our private lives. Is it constitutional? Now, the truth of the matter, having an individual mandate as a requirement that individuals purchase health insurance is not really a new idea. President Clinton had proposed an individual mandate back in 1993 as part of his Health Security Act. And other competing proposals at the time included a similar idea. Now we have Massachusetts, which is actually the only state in the country that requires that everyone over the age of 18 have health insurance. And this included an individual mandate as one way to achieve that goal. You have other countries like Switzerland and Netherlands that have also included such an individual mandate in their health reform plans. So it's not something that's unheard of, but here are 2 points of why this idea of the individual mandate may be controversial. Now, next we have the state health insurance exchanges, which include American Health Benefit Exchanges for individuals, small business health option programs for small businesses. They must offer essential health benefits, and there's 4 cost levels for plans based on actuarial value. So these health insurance exchanges were set up to allow everyone to compare health plans and find out if they qualify for Medicaid or tax credits. So here is a list of how the Affordable Care Act has improved health insurance. Now we have parents that can add their adult children to their plans. If anyone gets sick, the insurance company can't drop them from the plan or limit how much insurance your family uses. If any children are chronically ill, a new insurance company can't deny you. Insurance companies can't raise premium payments without getting the okay from the state government. And most families will find that wellness or pregnancy exams are now free. And that will give you an idea of some of the perks that came along with the Affordable Care Act. Here are a list of a number of points that are included in the Affordable Care Act, as you would find in the following slide as well. Now, I'm going to be wrapping up this short video lecture. I just wanted to include that the Affordable Care Act, does have 10 titles or sections. The first one is Quality in the Affordable Health Care Act for All Americans, which includes that individual mandate. Then we have Title II, which is the role of public programs. Title III includes improving the quality and efficiency of health care. We have Title IV, which is the prevention of chronic disease and improving public health. And then Title V on the healthcare workforce. Title VI, which is on the transparency and program integrity. We have Title VII on improving access to innovative medical therapies. Title VIII focuses on the Community Living Assistance Services and Supports Act. Title IX is on revenue provisions, and Title X is on reauthorization of the Indian Health Care Improvement Act. I'm not going to be going into detail for each title. I just wanted to briefly list them for you and make sure that you read the chapter, review this full presentation, and if you have any questions, don't hesitate to let me know. All right, everyone, take care. Bye.